David Gonzalez, Mia Lee, and Henry DiCarlo with weather. You're watching KCAL 9 News at 2.
And in Health Watch this afternoon, will Americans or our doctors eventually conquer heart disease?
Also, a local expert says yes, and it may happen in the near future. KCAL 9's Health Watch reporter Dilva Henry joins us now with all of this.
That's right, and conquer may be overly optimistic, but at least get a handle on it, because right now the numbers are just staggering. We've heard a lot about heart disease in the past month, and for good reason. It kills nearly 1 million Americans each year. But a local cardiologist says there is reason for optimism when it comes to the future of treating heart disease. We know heart disease is America's #1 killer, but is there any hope on the horizon? Can Americans look forward to a brighter future when it comes to treating heart disease? Cardiac surgeon Dr. James McPherson of Centinela Freeman Hospital says yes.
The future of bypass surgery is that we're doing more of these operations without using the bypass machine, and that helps us to decrease the incidence of stroke and also can return people to active lifestyles much sooner.
In terms of detecting heart disease,
here at Centinela we're getting a 64-slice CT scanner, and that may ultimately obviate the need for angiograms as we do them now.
Good news, since angiograms involve injecting contrast dye, which doctors say can possibly damage the kidneys.
The 64-slice CT scanner can give us the same images, many times better, without the contrast, and I think it's a lot more accessible to patients.
But it appears most of the advances in treating heart disease will be in the area of medications.
What we are also looking at now is genetic control of heart disease. I really believe that that is where the future is.
Specifically when it comes to cholesterol.
The future, I believe, is to manipulate the body's ability to metabolize cholesterol. Once we can do that, I think we'll find that the incidence of heart disease is much less.
That, Dr. McPherson says, is about 5 years out.
Once that happens, we will no longer need to take as many statins as we're taking to keep the cholesterol down.
He says improvements in blood pressure medication are also on the way.
We're also working on many new classifications of drugs to treat hypertension, and hypertension or high blood pressure is a big risk factor for heart disease.
Of course, as you've heard many times before, prevention is the best medicine, and yes, that means watching your diet and exercising regularly. Of course, we always have to add that because that does help, lowers your risk for high cholesterol, high blood pressure, heart disease.
We hear it all the time, but do we really do it? That's the hard part.
I know, you get a chance this weekend, well, except for the rain.
Except treadmill.
There you go. Prevention, the best medicine, right?
Always.
Always.
Yep.
Thanks,
Thank you, Dilva.
Sure.
Well, they adore